Hello and welcome to The Explainer. Today, we're diving into something pretty much all of us have dealt with at some point, bleeding gums. You know, you spit in the sink, see a little pink, and probably think, I just brushed too hard. Well, actually, the reality is a whole lot more fascinating and, honestly, a bit more urgent. In today's Explainer, we're going to figure out exactly why bleeding gums are an early warning sign from your body that we absolutely shouldn't ignore.
So let me ask you straight up. Do your gums ever bleed when you're brushing? Or maybe when you finally decide to floss? It's so easy to just rinse it down the drain and totally forget about it. But what if I told you that your gums are literally trying to sound an alarm? What you might brush off as just a minor annoyance is, medically speaking, the very first indicator of a totally silent disease process.
And really, that's the core thesis of our Explainer today. What starts out as simple gingivitis can slowly and silently progress into something incredibly severe called periodontitis. We're not just talking about sore gums here. If you leave it unchecked, this progression can permanently damage the actual bone that supports your teeth and, eventually lead to outright tooth loss. It's a one-way street if you let it go too far. So today, we're going to map out exactly how that journey happens. All right, let's kick things off with Section 1, Anatomy of Healthy Gums. Because, we really have to know what good looks like before we can start spotting the bad. So your tooth's support system is known as the periodontium, and it's way more than just your gums. Each tooth is actually supported by 4 key parts: the gingiva, which is the gum tissue, the periodontal ligament, the cementum, and the alveolar bone. Together, the whole shebang forms this crucial foundation that literally locks your teeth in place. A healthy periodontium, it's pink, it's firm, and the biggest takeaway here, it has absolutely zero bleeding when you brush. That is our golden baseline. But, well, what happens when things start to go sideways? Let's move on to Section 2, Gingivitis, the reversible warning. It pretty much always starts with slacking a bit on the oral hygiene. First, you get this sticky biofilm called plaque. It's basically a mix of bacteria, food bits, and salivary proteins building up right near the gum line. Over time, those bacteria essentially poke the bear. They trigger your body's immune system, sparking an inflammatory response. And finally, this inflammation causes vasodilation, which means the blood vessels open wide, leading to tissue edema, or swelling. Basically, your body is sounding the alarm and fighting back.
So if we want to get formal about it, gingivitis is simply the inflammation of the gums without the destruction of those deeper supporting tissues. And that's a super important distinction. Even though your gums might be swollen, red, and angry, the periodontal ligament and the alveolar bone underneath, they are still perfectly intact at this stage.
Now, here is the absolute most important takeaway. In gingivitis, the damage is still reversible. Seriously, I cannot emphasize the word reversible enough. This is the silver lining right here. Your body is throwing up red flags, the gums are inflamed, sure, but the actual structural foundation of your teeth hasn't been compromised. You can literally turn the ship around. But how do you actually know if you have it? You'll usually spot bleeding, swelling, redness, and maybe some bad breath. But here is the massive trap. Pain is almost always totally absent. That's exactly why people just ignore it. Beyond just skipping the floss, other triggers include smoking, diabetes, hormonal changes like during pregnancy or puberty, breathing through your mouth, and even certain medications like phenytoin and cyclosporin. It's an incredibly sneaky condition.
Okay, now if you ignore that painless little warning, we cross a very dangerous threshold into Section 3, Periodontitis, irreversible destruction. Periodontitis is defined as a chronic inflammatory disease causing the destruction of the periodontal ligament, the connective tissue, and the alveolar bone. Do you catch the difference there from gingivitis? Now the inflammation has dug way deeper. The very foundation of your tooth is literally crumbling away. We're no longer dealing with just a surface issue, this is permanent structural damage. Let's walk through exactly how this breakdown happens. Step 1, that bacterial biofilm keeps activating your immune cells, and they start releasing mediators like cytokines, prostaglandins, and destructive enzymes. Then, in Step 2, this is where friendly fire happens. Those mediators don't just kill bacteria, they actually start gradually destroying your own connective tissue and bone. And Step 3 is where the vicious cycle locks in. As those structures break down, the gums literally detach from the tooth, creating these deep periodontal pockets. These deep spaces act as perfect little traps, catching even more bacteria, which just accelerates the whole terrible process. The clinical reality at this stage is, frankly, pretty severe.
we're looking at significant gum recession, loose teeth, pus discharge, and really severe halitosis, or chronic bad breath. Ultimately, this leads to the tooth just completely falling out. And if a dentist takes an X-ray, they'll see obvious horizontal or vertical bone loss around the roots. The damage at this point is permanent. There's no going back.
To really drive home the difference between a warning light and a full-on engine failure, let's look at Section 4, comparing the two conditions. The dividing line here is just stark. Gingivitis involves the gums only, while periodontitis attacks both the gums and the bone. Bone loss, totally absent in gingivitis, but absolutely present in periodontitis. The most critical factor for you to remember is the damage itself. Gingivitis is reversible, periodontitis is irreversible. And finally, because the bone is perfectly fine in gingivitis, your teeth don't move. But in periodontitis, as that bone gets eaten away, tooth mobility kicks in, and they start getting loose. To really lock this in your brain, just keep this one little mental model handy. Gingivitis affects the gums. Periodontitis affects the support system. If you keep that quote in mind, you'll always understand the fundamental difference between these two stages. All right, we understand the mechanics now. Let's pivot to our final phase, Section 5, Risk Factors and Treatment. Here's what you need to know. Now, for the medical students out there tuning in, the specific heavy-hitting anaerobic gram-negative bacteria we're talking about are Porphyromonas gingivalis and Aggregatibacter actinomyces timicomitans. Quite the mouthful, right? Beyond the bugs, risk factors like uncontrolled diabetes, high stress, genetics, and immunocompromised states play a massive role. But listen to this. Smoking is especially dangerous here. Why? Because smoking actually reduces gum bleeding by constricting your blood vessels. It acts like a mask, tricking you into thinking your gums are completely healthy, when in reality, a severe disease is raging right underneath. Wild, right? Treatment scales up incredibly fast depending on the stage. If you catch it early at the gingivitis phase, the plan is a breeze. Professional cleaning, scaling, maybe some chlorhexidine mouthwash, and just learning proper brushing techniques. Boom, totally reversed. But if you let it slide into periodontitis, you're looking at much deeper scaling, root planning, strict diabetes control, quitting smoking, and probably antibiotics. And if it progresses to advanced cases, now you're facing intense surgical interventions. We're talking flap surgery, bone grafting, and complex regenerative procedures just to save whatever tooth structure is left. Look, at the end of the day, the absolute best treatment is prevention, and you have the power to stop this entire chain of events from ever starting. Brush twice daily, floss regularly. Seriously, you have to get the plaque your brush misses. Avoid smoking, cut down on the sugary foods that feed the biofilm, and get regular dental checkups. Early diagnosis and just sticking to these simple habits can absolutely save your gums and your teeth. Which really leaves us with one final vital thought to chew on. Ignoring bleeding gums today risks the teeth of tomorrow. So are you protecting your foundation? The next time you brush and see a little pink in the sink, please don't just rinse it away. Remember the journey from a totally reversible warning to completely irreversible damage. Take action, protect that periodontium, and keep smiling. Thanks so much for exploring this with me today, and I'll see you on the next explainer.